For decades, we've been taught that taking care of our health means regularly getting checkups. The idea seems safe, almost obvious. After all, who wouldn't want to catch a disease early and avoid bigger problems down the line? But there's a hidden truth that few have the courage to share. Not every test is good for you, especially after 60. And as time goes on, our bodies become more vulnerable to procedures that seem harmless. In many doctors' offices and hospitals, the scene repeats itself. People over 60 leave their homes thinking they're doing the right thing. They walk into clinics with smiles, trusting the promises of prevention. But some leave with injuries. Others return with diagnoses they didn't have before the test. And there are those who never make it back home. In recent years, the number of hospitalizations due to complications from invasive tests has increased. This is especially true for seniors who underwent unnecessary procedures, done more out of protocol or insurance pressure. In a world that values quantity, we've forgotten about quality. We perform tests in series, repeatedly, invasively, without asking, is this test really needed? Is there another way? If you're over 60, you need to know that your body doesn't react the same way anymore. Certain tests, when wrongly prescribed, can be more dangerous than the disease they're trying to detect. The goal here isn't to cause fear, but to raise awareness, because health isn't about running after tests. It's about taking care with wisdom and discernment. And you, sitting here with me, need to answer honestly. Have you ever had a test that made your condition worse instead of better? Share your story in the comments below, and let me know where you're watching from. Also, leave the phrase, "My health is a priority," in the comments to show you care about what really matters. Why does the body react differently as we age? As we grow older, our bodies change in ways that aren't always visible. The skin may show wrinkles, but the changes inside the body are where things become riskier. The gut loses its sensitivity, the kidneys become less efficient, the heart tires more easily, and the immune system no longer responds with the same strength. That's why certain tests that seemed simple in your 30s or 40s become a risk after 60. Not because the test itself is bad, but because of the state of the body receiving it. A contrast CT scan, for example, can overload weakened kidneys. A colonoscopy done without clear symptoms can cause bleeding or perforations in more fragile intestines. Imagine an old electrical system. The wiring is still there, working, but the accumulated wear requires much more care. A wrong move, too much energy, and everything shorts out. That's how the body of someone who's lived a long life works. It needs respect, not thoughtless intervention. Preventive medicine should protect, but if done without wisdom, it becomes a minefield. Tests are important when prescribed correctly, but dangerous when done without context, without listening to the body, without seeing the person behind the patient. There's another key point to consider. Many of these procedures require sedation, fasting, or internal manipulation. Each of these steps is another challenge for someone with a slow metabolism, weaker defenses, or a hidden condition yet to be discovered. That's why trusting generic protocols is like assuming all bodies are the same, but they aren't. What works for a 50-year-old man may not be safe for a 70-year-old woman. Medicine that respects aging isn't about doing more tests. It's knowing when not to do them. It's this careful approach that separates the life-saving test from the one that opens doors to complications. Because when health weakens, even a simple procedure can trigger irreversible consequences. The body speaks, and when it ages, every whisper needs to be heard carefully. Ignoring this means what should be healing can become a risk. The 6 tests that could put your life at risk after 60. When there's no individual assessment, what should be a preventive measure becomes a risky gamble. There are tests that, despite being widely recommended, should be approached with extreme caution in those over 60. Not because they're bad in themselves, but because they can cause serious harm when done without proper criteria, without real need, or in bodies that can't handle so much invasion. The first is the colonoscopy, often done without clear symptoms. While it's important for detecting colon cancer, it's an invasive procedure. The intestines of someone over 60 are more delicate. In many cases, there's a risk of perforation, bleeding, and even hospital-acquired infections. For frail individuals or those with associated conditions, the risks may outweigh the potential benefits. Another test to watch out for is the contrast CT scan, especially in those with weakened kidneys. The iodine-based contrast used to enhance the images can cause allergic reactions and kidney overload. Aging kidneys have a reduced ability to filter toxin, and this kind of test could speed up kidney decline. It's also common to see digestive endoscopy done in seniors without relevant symptoms. When needed, this test can be useful, but for those over 60, especially with other health issues, the risks of sedation, internal manipulation, and potential lung aspiration need to be considered. A simple stomach discomfort might be better investigated with other methods before opting for something so aggressive. For men, the repeated or unnecessarily performed prostate biopsy also needs caution. Often the suspicion is based solely on altered blood tests, and the biopsy is done out of protocol, but the procedure can cause bleeding, infections, and urinary problems. In many seniors, the cancer detected at this stage might not even grow aggressively, making the intervention unnecessary and potentially harmful. Among women, mammograms in seniors without a family history or symptoms can seem like a safe choice. However, at this age, the risk of false positives increases, leading to unnecessary biopsies, surgeries, or treatments. For many, the emotional stress caused by this outweighs any potential benefits of screening. Finally, the cardiac stress test, especially when done without a prior clinical assessment, deserves attention. This test requires the patient to walk or run on a treadmill while the heart is monitored. In seniors with a history of high blood pressure, arrhythmias, or joint issues, this stress can cause dizziness, falls, fainting, and even serious cardiac events. Before making someone run, it's important to evaluate if their body can handle it. Each of these tests has its use when properly prescribed, but when applied blindly, without listening to the patient's history, they can cause more harm than good. What's even sadder is that many seniors are not informed about this. They simply receive a list of tests and believe they are being taken care of when, in fact, they're being slotted into protocols that don't see the human behind the numbers. It's time to break away from this mindset, because aging with dignity isn't about undergoing every available technology. It's about being seen, heard, and respected for what really matters. When healthcare becomes automatic, mistakes disguise themselves as routine, and that's where the danger lies. When a test harms instead of heals. The case of Mrs. Edith. Mrs. Edith was 74 when she first came to the clinic. She was accompanied by her daughter, walking slowly with a tired look and a weak voice. She wasn't like that before. According to her daughter, just a few months ago, Mrs. Edith took care of the plants in the yard, did her morning prayers, and even helped prepare family meals. But everything changed after one test. She felt mild stomach discomfort and went to the emergency room. There, they urgently recommended a colonoscopy. No cancer history, no bleeding, no significant changes in blood tests. Just discomfort. She had the test the next day. There was no proper explanation or deeper evaluation, just the protocol. 3 days later, the symptoms began. Severe stomach pain, fever, diarrhea. She returned to the hospital, and after more tests, they discovered an intestinal perforation caused during the procedure. Mrs. Edith was hospitalized for almost 2 weeks, on strong antibiotics and with no food. She lost weight, mobility, and even the will to talk. What should have been a routine check turned into a painful path, and the hardest part is knowing that it might not have been necessary. A little more listening, a more careful look, a decision based on the person rather than the numbers. Her daughter, still emotional, said a phrase I'll never forget. She went in search of care, but the care turned into suffering. Mrs. Edith survived, but her life was never the same. Now she walks less, feels scared to go out alone, and takes medication she didn't need before, all because there was no discernment between doing something out of obligation and doing it out of real need. Stories like hers aren't exceptions. They're quietly repeated behind cold reports and automatic protocols, What's missing isn't technology, it's wisdom in using what we have at the right time, with the right person, the right way. Because health isn't a procedure, it's a human touch. And when that touch fails, what should heal may sadly harm. How to protect your body without sacrificing prevention. Not everything needs to be extreme. The problem has never been with the tests themselves, but with how they're applied. The best way to protect yourself is by asking the right questions before undergoing any procedure. Why was this test requested? Is it really needed now? Is there a less invasive way to investigate the same issue? These questions aren't signs of distrust. They're signs of care. As we age, our bodies don't need aggression. They need to be listened to. Instead of stacking tests, the path to good health might be found in daily choices, in food that reduces inflammation, in habits that strengthen the immune system, and in the careful attention to the silent signals our bodies send. The most interesting part is that the stronger you make your body with real food, quality rest, and a calm approach, the less you'll feel the need to rush into diagnostics. Prevention isn't about excessive tests. It's about avoiding what harms you. There's a wiser way to care for your health, and it starts with what's on your plate. What you eat every day over the years is what defines your body's strength or fragility. The good news is that this is within reach of anyone, at any age. All it takes is learning, applying, and sticking with it. If you feel it's time to start taking care of your health with awareness and wisdom, you need to check out the Recipes for Staying Healthy guide. It's made for people who don't want to depend only on tests and medication, people who want to strengthen their bodies with what nature provides. Simple recipes with affordable foods and powerful combinations. The link is below in the description and in the pinned comment. Because when food is your medicine, medicine becomes unnecessary. And this is exactly how many people are taking control of their own health. Not out of fear, but out of knowledge. Not in a rush, but with decision. Not by excess, but by balance. Taking care of yourself is the greatest sign of love for life you can give. There's still time. There's always time. A test might help you, or it could harm you. Forever. It's not about rejecting medicine nor living in fear. It's about understanding that not everything presented as care is true protection. Some tests save lives, but others, when done at the wrong time, without preparation, can cause long-term damage. When they do heal, the decision to test or not should come from careful listening between doctor and patient. It should consider age, real symptoms, medical history, emotional state, and life goals. You can't reduce care to a series of automatic protocols. Each patient has a story, and within that story are different times, different limits, needs that only appear when you look closely. When you ignore this, what should be a healing path can turn into a dangerous detour. That's why, before accepting a test, just because everyone does it, ask yourself if it's really necessary in your case. Ask yourself if your body is ready, if there are other ways to investigate, if there's a better time. And above all, remember that the final decision is yours. Now tell me, have you had a test that left you with lasting consequences? Or do you know someone who went through that? Share your story in the comments below. It could help others open their eyes too, because sometimes true care isn't about doing more, it's about doing better, with patience, discernment, and love for your own life.